My name's Melody Anthony, and I'm the State Medicaid Director. And we are here today to facilitate a question and answer section and share information with our hospital partners on what the agency has been doing since COVID-19 hit the nation in March. So I'm going to turn it over to Traylor, and he will guide us through it.
Good afternoon. Thanks everyone for joining us. I'm Traylor Raines, Deputy State Medicaid Director at the Healthcare Authority. So Melody and I thought it would be a good idea to have these sessions at lunchtime every day this week and kind of into next week. We really wanted to focus on each of our individual provider groups to give you the most up-to-date information that we have so far regarding our response as well as the federal response to the COVID-19 health emergency. So today, I'll go briefly through, the Healthcare Authority did submit an 1135 request to CMS, I believe it was March 17th. We received initial approvals fairly quickly, about 3 or 4 days after that from CMS. And at that time, CMS was getting inundated with requests from all states, understandably. And so they started issuing blanket approvals after that addressed basically all the requests that were coming in from the states. So I'll briefly on just kind of general requests that we have received approvals for, like for example, regarding member eligibility. So during the emergency period, through the Families First Coronavirus Response Act, CMS is offering states a 6.2 enhanced federal matching rate in order to help subsidize the additional costs that the states are incurring in order to accommodate treatment of our healthcare providers through the crisis. So in order to receive that 6.2 enhanced FMAP, there are certain conditions that come along with that, one of which is not terminating member eligibility or raising premiums on our current populations. So to accommodate that, we've adjusted our system internally, our eligibility system, to push those renewals out 60 days for now, and we'll extend later if we need to. But essentially, anyone that will have was scheduled to renew during the emergency period will push that renewal date out so that they will not lose eligibility. We are still doing our data checks with the IRS, the Oklahoma Tax Commission, and OESC and other entities, but we won't take adverse action on a member's eligibility based on those data checks coming back. The only reasons we would terminate eligibility is due to a member requesting to be removed from the Sooner Care program, or if they're no longer a resident of Oklahoma. So we want to ensure that all of our members have access to the treatment and testing they need during this time. We have also requested, but not yet received approval, but we are in the process of working on state plan amendments to address this. But we have our Insure Oklahoma individual plan that's administered by the Healthcare Authority. And in order to help our families and individuals covered by that plan, we've asked CMS if we can suppress premiums moving forward. So we're working with our partners on that and internally to see how we can accommodate that. We have also greatly expanded our coverage of telehealth services such that nearly most Sooner Care services, if possible to be done by telehealth, are now covered by telehealth and Sooner Care. We've done that by allowing the GT modifier to be added to any of those CPT or HCPCS claims so that they'll go through the system and pay. We have noted those updates through our global update process. So if you visit our website at okhca.org, in the provider tab, there's a link that says updates. Within that, you'll see global messages. That'll give you updates on, as you're familiar with, we update based on individual provider type and how it affects you and your providers. As far as hospitals go, we have received flexibility in how we proceed with conducting our provider enrollment processes moving forward only during the emergency period, such that if you have individual rendering providers that you normally enroll through our provider enrollment, we can have flexibility such as waiving background checks, waiving the fingerprint-based criminal background checks, our site visits, our screening levels, and our application fees. That is only during the emergency period, and we're tracking individuals that come in and enroll under these guidelines, such that once the emergency period has ended, we can go back and ensure that these individuals, if they choose to remain a Sooner Care provider, will then go back through those steps and fulfill the regular requirements. We also received approval, and CMS has issued blanket approval for specifically for hospitals that desire to set up alternative locations to better serve those COVID-19 positive individuals, or if they need to evacuate current hospital bed occupants into an alternative location in order to serve higher acuity COVID-19 positive patients within the hospital. So they're giving us flexibility such that you don't have to be licensed at the alternative site. There are certain Medicare conditions of participation that are waived at that site. So if there's any hospitals interested in going down that road, we're asking that you apply for a separate provider location on your current contract. That way we can track where the expenditures related to the alternative site would occur. So I'm going to share a screen now with the guidance document that we received from CMS. And we can send this link out afterwards also to this group. But it essentially gives all the emergency declaration blanket waivers for providers that CMS has issued so far. I would say that the majority of these were also included in our request, so it's comprehensive. We can also put a link to this on our COVID response webpage on our public-facing site. That is okhca.org/COVID-19. So we have this as well as a chart that explains our individual requests, the date they were approved by CMS, and then those blanket waivers, and then our requests that are still pending. So you'll see here too that for hospitals, there's certain provisions of EMTALA that have been waived. And this is specifically for if you have individuals presenting to your ER, for example, that normally EMTALA would require that you not be able to turn them away. You can do that in the instance where it would be more appropriate for someone to receive COVID-19 testing at an alternative site rather than the ER. So there's certain EMTALA enforcement that is being waived. Let's see. So I would advise facilities, if you haven't already, to go through these in detail and possibly have your legal team review, because it's my understanding that there are just some Medicare COPs that are being waived and not all. And it would be incumbent upon the facility to make sure that if you do set up an alternative site, or if you are making accommodations within the way you provide treatment internally, that you make sure that you're waiving the right COPs and still maintaining compliance with the others. We are still, we have received approval to waive our prior admission, PA, our prior authorization requirements. But to date, we're only reserving that option in the case that we are unable to continue to process PAs through technology or our human resources internally. So far, we've been able to maintain all of those processes, and they're moving forward as they usually would. The only difference, and I don't think this would be an issue for this provider group, but we are not accepting any paper claims anymore during this time. So nothing on paper, everything needs to be submitted electronically through a provider portal or your EDI vendor. Let's see. So I think that's the highlights. We'll open it up for Q&A now. Just as a form of housekeeping, there is a Q&A panel at the bottom. Please submit your questions through that rather than the chat function. That way we can track all the questions, download them after this. We'll do our best to respond to questions live during the meeting, but we will also follow up by answering them all in writing and then posting the recorded version of this webinar along with the answered Q&A to our COVID-19 response page on our website. So the first one is, can the HCA 17 form be uploaded on the OHCA website? So I would defer to Jimmy or Aaron on that.
Hey, Trey, this is Aaron. I don't have a response to that, but we can check into it.
Okay. There's also a cannot submit claims over 1 year for retro eligibility must be by paper. OHCA portal will auto deny anything over 1 year from date of service. That's correct. So timely filing still applies to these claims. So Robin Tate says can get paid by paper with HCA 17 and MSMA 4 form. So we will follow up with detailed instructions on these forms and how they can be submitted electronically after this meeting. So while we're waiting for other questions to come in, Mel, do you have you noticed if I left out any pertinent information or any updates you want to give that we've received in the past couple of days? As I'm sure everyone is going through, updates are coming in hourly, and we're having to shift and maneuver in real time.
Yeah, no, you were very thorough in your update. I do want to, since a lot of the questions seem to be around billing, because we do want providers to submit their claims electronically, I will probably have our provider services staff do a billing webinar for hospitals, as well as answer the questions and post them on the public website to make sure that the claims can be submitted timely.
We also recognize that we appreciate everything you and your staff are doing for our members. We know this is a hard time for everyone, especially those that are on the front lines working with clients who are receiving everyday course of treatment, as well as those that are receiving treatment and testing for COVID. We see you, we appreciate you, and we want to be as flexible as we can within the federal guidelines given to us so that you're able and best prepared to help our clients, and in turn, we'll do everything we can to help you. So if you encounter a situation where you feel like we can be more flexible or you need more flexibilities, feel free to reach out to us and we can consider those, and if we need to, get approval from CMS. So is there an email address for future questions that may arise? So we would direct you to provider services. Mel, do you know that off the top of your head?
It's, I want to say Sooner Care Education at okhca.org. I believe that's correct. We'll definitely get that out. That goes specifically to a provider service representative, and they assign those based off the need of the provider. So that is available. We will make sure that that is also posted.
And the provider helpline too, if you want to call in, is 1-800-522-0114. So there's a question on what is the site to go to in order to check the updates. So that is on our okhca.org/COVID-19. And also we have set that page up for web alerts. So if you go to the top of that page, there's an icon that says web alert, and you can enter your email and information there. And anytime we add information to that page, you'll get a notification that we've changed something, and it'll give you the link to the new information. So for instance, my guess is probably within 24 hours of this meeting, we'll have the YouTube recorded version of it, and we'll put a link on the COVID-19 page. You click on that, share with other staff that weren't able to attend today, if it's helpful, as well as the answered Q&As. Yeah, Dewana Vic just responded from our provider services that it is Sooner Care Education at okhca.org. Thank you for that, Dee. And there's also within the chat box links for our global messages, as well as the link for our COVID-19 response page.
Quiet group today.
I know. All right, so I will say we'll give it another minute for questions that we can respond to. But if you don't get a chance to ask now, then feel free to send it to the Sooner Care Education at okca.org, and then we'll work with provider services to make sure that gets responded to quickly and routed back to Mel and I if we need to see it. All right, seeing none so far, Mel, I'll throw it over to you to wrap us up.
Okay, well, thanks everyone for attending today. Please know that if you would like us to have another meeting with your facilities, just reach out to Trailer or myself, and we will make sure that we do another update via Zoom. We do, as Trailer said, appreciate everything you're doing for everyone in Oklahoma, not just our population, and encourage everyone to reach out to us to see if we can help in any way. So thank you very much.